Welcome, listeners and viewers of your award-winning Let's Talk America with host Shana Thornton radio show. I'm Shana, of course, on-air host and executive producer, and welcome to yet another episode of our program titled Real Talk. And we speak with the best and the brightest experts and advocates out there, and tonight's episode is no exception. I'm super excited to have an acclaimed veterinarian on with us, the one and only Dr. Jose Arce. He has been a veterinarian for almost nearly 25 years. He is based in beautiful San Juan, Puerto Rico. Dr. Arce, welcome to Let's Talk America Radio.
Well, hello. Thank you for having me, Shana.
Super excited to have you on. Now, we have a tradition here on Let's Talk America Radio. I've seen your resume. I've seen the bio. Of course, it's super impressive. That's why we invited you onto the program. But we always give our exclusive guests the opportunity to speak for 2 minutes or less to really talk about what got you here to be such an advocate for animals. And you've spent nearly 25 years as a veterinarian. Where did it begin? Did you love animals or science as a child?
Yeah, I come from a household of where science, well, medicine was the daily talk. My father was an ophthalmologist. Then my grandfather was a farmer, and he had all kinds of animals. So it was a natural connection, you know, the medicine, my love for animals. My dad insisted and wanted me to go to med school instead of vet school. And I made him happy, and I worked at some hospitals as a volunteer during high school and college, but I still, you know, my passion was for animals and veterinary medicine, and that's where I did it. And, you know, I first started with my grandfather, like I said, on the farm when I was a kid, and I would go there, you know, 5:30 in the morning and be with all kinds of farm animals. Then that's in Spain. My mother's side of the family is from Spain, and my grandfather was from Salamanca. Here in Puerto Rico, my godfather owned a farm, and I would go pretty much every weekend and spend time over there also with animals. There was a dairy farm. They had all kinds of dogs running on the farm. So I loved it. And it was a natural connection because of the medicine in the house and then my love for animals. So yeah, that's where it all comes from.
I love it. I love it. What a great passion. And today it allows you to be an advocate and expert on our animals. Let's talk animals. I don't need to tell anyone. We've seen so many of the storm fronts that came through, Fred and on. And we're just really getting started right now with all of the storms coming up, hitting the East Coast and really a lot of parts of the United States, obviously Puerto Rico and other areas. When I think of storm and storm preparedness, that so many times you see the meteorologists or the survival experts and advocates talk about, so many times they leave out of that conversation our beloved family members or pets, right? Because we love them. They're very cherished members of our communities and villages and families. But give us the one-on-one. What should we be thinking about? Because we often think about if we live on the beach or maybe outside of the beach, we're going to board up the windows. We've got to make sure we got water. We've got generators in certain parts. We've got our flashlights. But what should we be making sure we have for our beloved furry friends? Or all of them, really. I'm going to talk about the dogs. I'm going to talk about the cats. But also, you know, many people have lizards and snakes. What should we be doing and proactive about as we move forward, trying to make sure all of us stay as safe as possible?
Yeah, the key here is planning ahead of time. No matter where we live, the potential for a natural disaster or a man-made disaster is a possibility. We think it's not going to happen to us, but it can. It doesn't have to be a hurricane. It could be, you know, wildfires. It could be tornadoes, or it could be a chemical thing. So we have to be ready. And what we recommend is that way ahead of time, you start getting together like a pet evacuation kit, you know, something like a backpack or some type of plastic bin that you have ready. Because when these disasters happen, you can't wait for that moment to get everything ready. That's when you start boarding your house or you know, the windows, like you just said, you know, in the case of hurricanes. And in other times, we just have to run real fast when something happens, you know, like an earthquake or something. And planning ahead of time is the key. So basically, you know, that pet evacuation key is the key. And, you know, I can talk about the different things that need to be in it. And part of that is a first aid kit, food and medicine. Some of our pets have medical conditions that are, you know, they need long-term medication. And that's very important. When Maria hit Puerto Rico, many businesses were closed, including pharmacies. So, you know, if we have a pet, for example, with a cardiac condition, and he needs, you know, a couple of medicines to make sure that heart, you know, works under optimal conditions, and we don't have the medicine, then we could run into trouble. because the pharmacies are closed. So that's part of the thing that we have to just make sure that we plan ahead.
And planning ahead is so key. Thank you so much for pointing out the wildfires as well, because there's so many natural disasters, certainly that can come up. And thank you for highlighting that. I want to transition now into one other area of emergency, and that's the C word of COVID-19. Dr. Arce, you know, there has been something very devastating for the entire communities everywhere. I don't care where you are, in every continent. So much of the focus has been human beings, but I've heard information out there that our animals, our pets can also contract COVID. And if so, what are the symptoms? Is it as devastating as it can be in humans? And who's giving it to who? Are we giving it to our dogs and cats, or are they giving it to us? Help us out.
Okay, that's an excellent question. Up to date, there is no evidence that animals can transmit COVID to people. Okay, we can pass it to them. And usually they don't suffer severe symptoms. Certain animals, certain species are more prone to it. And we know from the SARS-1, which is the one that happened in 2006, 2007, that one we knew affected felines and it affected mustelids. And those specific animals we knew were prone to getting the disease. Now, the cases that we have seen with felines, there's been a few cats around the world, not too many. There's been some lions. There's been some of the mustelids, like minks, that get affected with the disease. But luckily, they don't suffer the disease. You know, the severe symptoms. They might have some mild respiratory staff, some mild GI signs. But to date, there is no evidence that they can transmit it to us, to people. And that's the good news, and that people need to keep in mind, because some of the words are like, oh, you gotta get rid of your animals, and people panic. No. Take the necessary precautions. If somebody in your household has COVID, try to keep the pet on your side or in somebody else's house, because the pet might not be able to transmit it to you. But if somebody with COVID happens to cough, or sneeze into that pet, and then that pet goes to another person that doesn't have COVID, and we happen to touch, exactly where the droplets are, and then put our hands on our mouth or our nose or on our eyes, then we can get it. But it's not because the pet is transmitted. It's because the pet is working as a fomite, which means that it's just basically transporting the particles from the animal to us. But it's not transmission through the pet's system.
I see. Yeah, great point. Vaccines, that's been all the rave, as you know. CDC, U.S. Surgeon General, many other medical experts have promoted and pushed it among humans as much as possible. Are animals eligible to get the vaccine? And if so, if not, how far or how close are we to that?
Okay, so this is a little complicated, but the one thing that a lot of people talk about, oh, this vaccine has been developed so fast, there hasn't been enough research. No, veterinarians have been working for decades on coronaviruses. There's coronaviruses that affect dogs, there's coronaviruses that affect cattle, and we've had vaccines for those. So this is nothing new. We just have to, use it now and design vaccines for humans. But the technology already existed on these same vaccines, on previous vaccines that were used for animals. So, it's part of at the beginning of the pandemic, a lot of the research that was done for the human COVID vaccines was done by veterinarians and was done in animals first, in monkeys, for example. Back in my school in Louisiana State University, back in Baton Rouge, they did some research. We also helped develop some of the COVID tests. And actually, some of the veterinary schools in many states provided those states with a place to give tests to the public when they really weren't ready at the beginning. So, veterinary medicine has played a key role. And this is one concept that I like to talk about during my year as president of the AVMA, is the concept of One Health. It's very important because the health of animals, the health of people, and the environment are all interconnected. And what happens in one species of animals can affect humans. We know that 70% of diseases that develop and affect humans come from animals. So we have to work together to prevent diseases in the future. And the COVID has been the perfect example. And we've been doing that. And that's something great. And it's exactly on the spirit of this One Health concept.
I love it. One health for the entire village and family. So just so we're clear as well, thank you for that great explanation. The vaccine for COVID is not to be used in animals right now?
So in some countries, I believe Russia, they have developed a vaccine that they have used in mink because there were a lot of mink affected, okay? And there's been research on vaccines for cats and dogs, but not too many have been affected. So we don't think it's necessary. You know, if the virus would mutate, you know, and kind of like right now we having the new variants with like the Delta, you know, if some type of variant developed that affected more dogs and cats, then we would definitely work on developing a vaccine. But right now it's not necessary because there's been very few cases around the world affecting dogs and cats.
I see. That makes sense. But thank you so much for the information. Everyone, you are watching Real Talk, Real People, presented by Let's Talk America Radio. I'm Shana Thornton, on-air host and executive producer. Have the pleasure of speaking with the one and only Dr. Jose Arce. He is an acclaimed veterinarian, and you see the acronym behind him. You also mentioned it, Dr. Arce. I did want to point out that the AVMA stands for the American Veterinarian Medical Association. So thankful for the partnership to bring this important information to our viewers and listeners. Thank you so much for what your organization is doing out there. Certainly appreciate that. I want to talk about something else before we conclude, and that's all the buzz that's been going on with animal adoptions. At least I know that where I am located in the U.S. People were quarantined, people were not doing as much, and you're seeing some of that come right back around again as the Delta variant and the Lambda variant is emerging. And so you had all these adoptions, right, of cats and dogs. I'm an animal lover, furry friends, but there's a part of me that wonders if when everything may get back to whatever normal will look like, just ensuring that people understand the responsibility that comes with adopting and loving our furry friends. Did you want to speak on that as an advocate for animals? Because I'm sure that may be a concern of yours as well.
Definitely. You know, adopting a pet or buying a pet, it's a responsibility for life. We buy them or get them from a shelter when they're cute puppies, and some of them might change. You know, we might get what we call here in Puerto Rico, we call them Puerto Rican terriers, that, you know, they're very cute and fuzzy, and, you know, with months and as they age, maybe they start getting, you know, different hairs and different colors, and they don't look as cute as they were when they were puppies, but, you know, they still are providing us love. We know from research that living with a pet makes our lives happier and healthier. We know that people that live with pets live longer lives. So we know there's a benefit. And there's even scientific research of people that live with animals, of hormones like oxytocin being released that help us relax, and they help us be happy. But, you know, when you get an animal, just think of it, if you're adopting a child, you're not gonna get rid of a child and just throw him out of the street. This is a responsibility for life. So we have to make sure that when we go to adopt an animal, a dog, a cat, or whatever other animal, a horse, it can be done. Just make sure that you're ready to take on that responsibility. You know, you wanna provide food, you wanna provide a nice environment, you wanna walk him, provide him exercise, take him to veterinarian for regular visits. It's a commitment for life. But also remember, you're getting a lot from that animal, and that's going to help you. And it's a mutual benefit that we call the human-animal bond. And there's a lot of research behind it, and it's good for the pet, but it's also very good for people.
Yeah, thank you so much for pointing that out, because that is so key. Before we wrap up, I did want to talk about the importance of our checkups for our furry friends or our scaly friends, because there may be people out there with reptiles. I don't want to exclude them as well. But talk to us of how important it is. You know, just as well as I do, you're a veterinarian, that as a COVID hit and as we continue to emerge out of it, many people skipped over their doctor's appointments. And I'm sure if they're doing it for themselves, they skipped over perhaps checkups for their animal friends as just as much. So talk to us about how important it is to continue to make sure that all of us are getting those checkups and those vaccines or shots or, you know, worm checkups as much as possible, so all of us can stay as healthy as possible. As you said, one health.
Yes, Shana, and definitely keeping your pet healthy, taking those regular visits. will make a difference. Preventive medicine is the key. If I, as a veterinarian, can see your animal twice a year, remember, for example, dogs and cats, one year of humans is about 7 of a dog. So you know how many things can change in 7 years? Well, the same can happen in 1 year in animals, and that's why we recommend twice a year checkups. Vaccine, it's prevention. There's a lot of diseases that can be prevented just by a shot. Some of them are given yearly, some are given every 3 years, but that's part of the prevention that will not only keep your pet healthy, but will also save you a lot of money, because the last thing we want is to have to hospitalize your pet, and if we can prevent it by giving a vaccine, that's the key. Good nutrition, feeding it a good diet is gonna help your pet live longer. Sometimes we say, oh, this diet might be a $1 more, $1.02 more, but a good diet is the key. Imagine if all of us ate, very, very fatty food all the time, we're gonna get into health trouble. We're gonna have cardiovascular disease. We're gonna have, high pressure. The same things happen with your pets. So providing, good food, good nutrition, preventive medicine. The other thing that I really advocate for is spay and neuter your animals. We know that animals that are spayed and neutered live longer. They don't suffer from mammary cancer, from testicular diseases, from prostate diseases, and they don't want to escape. One thing that people forget, especially the males, if they're not castrated, they want to run, they want to get out of the house, and they escape, they get hit by a car, and it's sad. So it's not only for their health, but also for them to be happier and to be one stay inside with their human counterparts.
And thank you so much for pointing that out, because I think sometimes many people buy into urban myths that are out there. And it's always great to have experts that really know the facts about so many different topics, especially important health topic of our animals and furry friends. Dr. Arce, what a pleasure and honor to speak with you about some important trending topics for our family members, our pets out there as well. Will you give us some contact information if people have additional questions or inquiries for your organization?
Yes, you can go to avma.org, and we have all kinds of materials there. Several of the topics we've talked about today, preventive medicine, vaccination, spay and neuter, disaster relief. All those topics are under avma.org. And we're there. We have materials in Spanish and English for all those Hispanic listeners that want to have some of those resources in Spanish. We also have them.
Thank you so much. It's about getting the information out to everyone as much as possible.